This video is looking at massage and cramp. Cramp is something probably all of us experienced at some point. That stop you in your tracks pain when a muscle goes into full spasm. You can't use the muscle that's cramping and the pain will certainly get your notice pretty quickly. Cramp is an involuntary spasm of the muscle caused when an already shortened muscle shortens further. It's very painful and it's very common. The most common area is the calf, but foot cramps are also fairly common. And you can get cramps in hands and arms too, particularly if you've maybe been doing some kind of DIY or your job involves holding, maybe a paintbrush, too tight for too long. Cramp will be the thing that will make you take a break and put it down. The majority, but not all, episodes of cramp occur at night. 60% of the adult population will report suffering from nighttime cramps at some point in their life. If you get nighttime cramps, it's not something you'll sleep through, so sufferers also end up feeling tired from interrupted sleep. If they're sharing a bed with someone, then that person is also likely to be awake as the sufferer leaps around the room proclaiming that they've got cramp. It's usually short-lived, anything from 30 seconds to 10 minutes, but you'll feel the effects in your muscle for around 24 hours after the cramp subsides. Cramp increases with age. If you're over 60, then 1 in 3 people are likely to get cramp. If you're over 80, it's 1 in 2. Pregnant women, children, athletes, those with physical jobs are more at risk than the rest of the population. When a muscle is already tight and shortened, cramp is more likely. Then when you go to sleep at night, the foot relaxes. For most people, the top of the foot will elongate, which puts the calf into a shortened position. Dehydration, working in heat, not stretching after exercises, these all increase the likelihood of cramp. There are no specific contraindications for massaging for cramp unless it's calf pain with accompanying swelling, redness or heat, in which case it needs investigating to check out DVT. You might also find that as a practitioner, if your client gets cramp as you're treating them, then you just need to slow down when working in that area so the muscles get time to relax and respond to the treatment. There's 2 parts to massage treatments for cramp. First of all, prevention. This is where the detailed foot and leg work that we've already covered comes into its own. This is the kind of work that will help to stop the cramp happening in the first place because you're stretching out the calf, you're releasing any tension in the foot. And secondly, there's the treatment during attack. We are maybe more likely to see this in loved ones, or we may see it on the table if a client cramps during a treatment. Remember, if it's an active cramp, then the area will be very painful, so don't just go digging into the muscle. In our work with our client, we're going to focus on the calf cramps as these are the most common, but you can apply the same principle to any other area of the body impacted, and there's instructions for this in the textbook. If the cramps don't improve, or if the client has any concerns or a complex medical history, then get them to visit their doctor. There are some medications for which cramps are side effects, including some diuretics and statins. Dehydration is a major cause, as is an untreated underactive thyroid. Imbalances in the body salts, such as high or low sodium or potassium levels, can lead to cramps, as can excessive alcohol and peripheral arterial disease. If in doubt, get your client to get checked out medically. In athletes and amateur sports people, not stretching after exercises can be one of the prime reasons, and it's a useful first line of questioning. The cyclists whose cool down is a final sprint to the pub can often remedy their problem with stretchers and water. So we're looking here at the practical work for the treatment on cramp. Now, of course, we're doing this in an ideal clinical setting where my client's laid face down, I've got oil to hand. Often this happens in the middle of the night where your partner is hopping around the room shouting, "I've got cramp." You don't tend to have a massage table there, you don't tend to have more oil. So where I'm using oil, you could just use any moisturiser that's to hand. We're going to start by just gently shaking the muscle out. Now you can do that both sides. I'm not pressing hard here, I'm just doing it enough to actually move the muscle. And we're going to do this for 10 to 20 seconds. Now this is while the muscle is actually in cramp. So if you can imagine this muscle cramping, it will be very painful. And so we're doing this shaking of the muscle. And then one of the key things to do, we're going to stretch the foot up. So I'm going to ask Pete to curl his toes up, and I'm just going to hold, I'm going to put some pressure on there. You can do this face up as well if you're doing this at home. And in that case, you hold the toes and you push them up, and we hold this stretch for about 20 seconds. So it's quite a firm grasp on the heel. And what I'm trying to do is I'm forcing this muscle to stretch. Then I'm going to release it. I'm supporting the foot back down, and I'm going to repeat that shaking. It should start to feel looser. The cramp should be starting to pass. And we're coming back into the stretching, and we repeat this shaking and stretching until the person reports that the cramp has gone. You'll see it in the leg as well, that when a muscle's cramping, you'll see the absolute definition of that muscle. Once it's gone, it returns to its normal position, but it can still be very tender. So assuming now that the cramp has started to abate, we're going to use a little bit of oil. I'm using oil here because we're in clinic, but as I say, it could be moisturiser, whatever you've got to hand. If it's in the middle of the night. And I'm stroking upwards from the ankle to 2 to 3 centimetres below the knee. You can see I'm just coming off below the knee. This is kind of the prevention thing, that this muscle that's gone into cramp, it will be very sore. So I'm trying to stretch it out a little bit. But as well, once it's cramped once, if it goes back to bed and the foot relaxes again, it's likely to cramp again. So if you're doing this on a partner in the middle of the night, it's also self-preservation, because it means in another half hour you won't be up again while they're leaping around the room shouting, "I've got cramp." So we're being much more gentle on the inner calf than we are on the outer calf. And usually this is the area that cramp occurs. You can see I'm just using long strokes. I'm just stopping before the knee. I'm not using so much kind of static pressure and some of the other moves here. It's a bit of a kind of first aid for cramp. After a few strokes on both sides, repeat the shaking of the muscle. And repeat that stretch. Again, remember that assisted stretch. And you're repeating those 3 or 4 times. I'll just show you another once for the purpose of the video. So we're shaking the muscle out. Sometimes you can still feel where the cramp has been, because it does take a while for the muscle to settle right back down. And then again, that assisted stretch. And it's assisted because you see I'm pushing down on there. And then we're going to finish the treatment by massaging the sole of the foot. And here you're placing your thumbs at the base of the toes, and you're moving both thumbs upwards and outwards quite rapidly. And you're working up towards the heel. Obviously, if someone's got plantar fasciitis, avoid the actual heel itself. So it's quite a quick movement. And what you're trying to do, you're just trying to lengthen this arch. But we're not going to, spend an hour doing a big foot and leg treatment in the middle of the night. So I say it's a bit of a first aid treatment. But if somebody's susceptible to cramp and they've come into your clinic complaining that they keep getting cramp, you can do the same thing. You can slow this part down if you want. But it can be also useful to teach them what to do. So this whole treatment shouldn't last more than 5 or 10 minutes. And the main thing is it should shorten the length of the cramp episode and hopefully prevent another one happening straight away too.